May is Mental Health Awareness Month, and our Dr. Mallika Marshall is here to tell us about two important areas of mental health research. Dr. Mallika, welcome. Good to have you with us. Let's begin with a new study that finds universal screening of teens with depression could potentially improve outcomes without costing a lot of money.
That's right. Did you realize that 1 in 5 teens in the U.S. experiences a major depressive episode each year? That's 20% of kids. And depressed teens are more likely to use illicit substances and experience anxiety, have eating disorders, and even consider suicide. Now a new study published in JAMA Health Forum looked at screening teens for depression every year, every 2 years, once at age 12, and the usual care, which was defined as a 20% annual screening rate. They found that screening teenagers every year for depression during primary care visits with their pediatricians would be the most cost-effective.
Did they find that universal screening could, what ways could they make it more cost-effective?
That's right. So they're saying it could be more cost-effective if health systems actually improved access to virtual behavioral health counseling, if they decreased treatment costs, and improved treatment effectiveness. They could save even more money. But I just want to say to parents and caregivers out there that if you think that your child could suffer from depression or anxiety or any other mental health condition for that matter, discuss their symptoms with their pediatrician.
And we're reading that scientists in Taiwan have developed a tool to help clinicians more precisely diagnose patients with mental health conditions?
Yeah, so they actually won an award for this discovery. They're pioneering a cutting-edge technology called Brain Probe. It uses AI to analyze brain images and identify abnormalities that aren't visible to the naked eye, which of course could help doctors more precisely and objectively diagnose psychiatric conditions. For example, patients with schizophrenia exhibit different patterns of brain abnormalities on a scan than someone with bipolar disorder or major depression.
So if the technology obviously helps diagnose the patients more accurately, I assume it could also improve the treatment of these conditions, potentially?
Yes, it actually could, because being able to pinpoint regions of the brain that are associated with various mental health problems could allow doctors to more precisely target those areas with treatments like deep brain stimulation or transcranial magnetic stimulation. And they expect that the same tool could be used for the early diagnosis of neurodegenerative diseases, things like Alzheimer's disease and Parkinson's disease.
Incredible. Dr. Mallika, thank you. Always good to see you.
You too, Chris.